I'm Professor James Nazroo. I'm a professor of sociology at the University of Manchester. I've been studying ethnic inequalities for almost 30 years, and I am one of the people who's co-leading a new survey, the Evidence for Equality National Survey, which is focused on ethnic and religious minority people's experiences in this current time of crisis. This is the first survey of its kind in the UK. It's the first survey of its kind for a number of reasons. One is its comprehensive coverage of ethnic and religious minority groups living in Britain. This is crucially important because many surveys just miss large segments of the ethnic minority or the religious minority population. The other thing that's really novel about this survey is its size in terms of the number of respondents we are aiming to achieve. Overall, we aim to get 20,000 people in this survey, maybe a few less, maybe a few more, but 20,000 is the biggest survey that's ever been held in the UK of this nature. And then the third thing that's absolutely crucially novel about this study is the range of topics we cover. For the EVENSurvey, we're focusing on the full range of ethnic and religious minority groups. And particularly important is the focus on religious minority groups. So often when you study ethnic minority populations, you perhaps have enough people of Muslim religions to say something about Muslims, or you may have enough people of Sikh religion to say something about their experiences. Almost always, Jewish people are missed out from these studies. And so we are particularly keen, additionally keen, to include Jewish people in this survey, so we can say something about their experiences of discrimination and inequality. At this point in time, we know, for example, that Jewish people are at much higher risk than the general population of dying from COVID-19 related conditions. But there's almost no detailed evidence on the lives of Jewish people in comparison with the lives of other groups of people. And so that's what this survey will allow us to do. It will allow us to say something about the inequalities faced by Jewish people compared with other populations, including anti-Semitism, including health inequalities, and so on. One of the other really important things about the EVEN study is its collaborative nature. So we're a collaboration of academic experts from a range of universities across Britain, but we are also a collaboration with VCSE organisations who act as our partners in this study. And this is absolutely crucial because what it means is that the voices of ethnic minority people and religious minority people are reflected in the survey through that partnership. The concerns that those VCSE organisations have are reflected in the questions that we ask. But also important is that when the data are analysed, when the results come out, those organisations can use the findings for campaigning purposes. So not only us, we'll write papers and reports and so on, but we can also work with our partners to campaign and to support their campaigns to address inequality. The EVEN study will have both short and longer term impacts. The short-term impact will be to highlight the difficulties faced by ethnic and religious minority people in Britain today at this point of crisis, during the COVID pandemic, during the economic downturn and the social difficulties that resulted from the COVID pandemic. Highlighting that and highlighting the ways in which racism and discrimination affect their lives is an important message to get out now, and that's what the EVEN study will do, what the EVEN survey will do. But in the longer term, of course, this information will feed into policy discussion. So those policy discussions that are either directly around the lives of ethnic and religious minority people, or the impact on the lives of ethnic and religious minority people, will have this evidence base to draw on to make sure that the decisions that are made become more equitable. And this is across the full policy spectrum. So it goes from housing to employment to education to health to policing and so on.